Hi, it's Dr. Centeno, and today we're going to talk about how the amount of curve in your back could be causing pain, and also talk about the psoas and quadratus lumborum muscles. So we're going to talk about these two muscles. The first is the psoas, which connects the spine to the hip, and it's highlighted in yellow there off on the left picture, and you can see that it starts up in the spine, up in here, and it goes all the way down into the hip down in here. This is another picture off to the right of the psoas. The other muscle is the quadratus lumborum, spine, and down that connects the spine to the ilium and rib cage. So you can see it off on the left here, up in the ribs. It's connected to the spine in here, and then down to the ilium, which is the side of the hip. Now, these muscles balance each other like guy wires holding up a sailboat mast, and you can see here in this MRI image to the left, which might not look like much, but this is a transverse process here. This is a transverse process. Those are the bones that come off the side of the spine. That's this one over here on the right on this image, so it gives you a sense of where you are. And then you can see some muscles coming off this way and that way. The muscle to the left here is the psoas, the muscle to the right is quadratus lumborum, and you can see how they balance each other out. So that's the MRI slice we're looking at, and that's where those muscles go. Now, a weak psoas can cause issues. If you've got weakness in a muscle pulling this direction and you've got overpull of a muscle pulling backwards, it's going to decrease the curvature in the spine. And that's going to cause problems because that's going to put more pressure on the discs. If we go the other way and we have too much pull up front through the psoas, it's going to increase the curvature in the spine, and that's going to cause more pressure on the facet joints. So if you have too little curve, you're going to want to strengthen the psoas and see if there's a pinched nerve that might be making it weak, or we want to get rid of spasm in the quadratus lumborum through treatments listed here. Different types of conservative care. If that doesn't work, platelet-rich plasma injections. If you've got too much curve, then you might want to strengthen the quadratus lumborum or get rid of spasm in the psoas. So if you want to find out more about all of this and ways to help back problems, go find out more at regenix.com. That's Regenix with 2 X's. And thanks so much for listening.